Hi, I'm Justin Varney. I'm the Director of Public Health at Birmingham City Council. And I thought I'd do a short video to talk a little bit about our Public Health Graduate Intern Programme. So these are 12-month roles. They're fixed term and they're really designed to help people who've got the know-how. They've got a degree in public health or a master's in public health or an equivalent qualification to get their foot into public health practice and really get a year of projects and experience that will give you your start in the public health world, because that's often one of the biggest challenges, I think, in getting into public health, is just getting in the door, even if you're really passionate. So the roles are all slightly different and we advertise them at different times during the year. And there are some videos in this channel from graduates that we've had before who talk a bit about what they've learned, what they've done, and also some tips and hints on applying for these roles and what to expect. So I hope that will be really helpful for you as well. Birmingham's a fantastic place to come and do public health. I would say that I'm the director here. It's my team, it's my city, it's brilliant. We're the youngest city in Europe, one of the most diverse. This is one of the largest councils in Europe as well. So we have responsibility for about 1.2 million people. And we have a 12-year life expectancy gap across the city. So between one part of the city and the other, men live on average 12 years less than each other, which is shocking. That's the kind of gap we see across the whole of London, which is about 9 times our size. There are lots of things going on, lots of areas where we're doing work, from trying to tackle infant mortality to really trying to get into what's underpinning the inequalities affecting our African and Caribbean communities through our Black Year Review, to the work we do with the Birmingham Poverty Truth Commission, putting the voices and lived experiences of people living in the city into the heart of decision making, next to the people who are making the decisions, so that we're really thinking through what the impact of our policies and our decisions are. So there are lots and lots of different things going on. We work internationally with cities across the world. So we're working with Pune in India on food. We've been doing work with other cities across the world as we lead into the Commonwealth Games in 2022 on food systems as well. We're part of the Milan Urban Food Policy Pact and the Delice network of cities who are focusing on food as well. So lots of work around the food system, because actually what we eat makes a huge difference to our health. The food economy in the city creates lots of jobs. What we throw away from food has a big impact on the environment. So lots of work going on there. We have projects going on physical activity, which are focusing on how can we get people walking more every day and cycling in those short everyday journeys. We have programs of work on workplace health. We do a lot of work around the life course, so focusing on children, young people, adults and older people. We've got some brand new teams we're developing, working on environmental public health and developing our approach to COVID recovery for health inequalities and the gaps across the city. So there's loads of stuff going on. And the great joy of coming into one of these graduate roles is, although we've kind of set out some of the things that we want you to have as kind of major projects, there are a lot of minor projects and smaller things you can do over the year that really build your public health experience and your public health practice, and give you some of those evidence of how you turn the know-how into the show-how to really build and start your public health career going forward. Things graduates have done over the last year working with us. We've had graduates who've done projects on social media and using Instagram and Twitter. We've had graduates who've done deep dives into the evidence base of inequalities affecting specific communities. We've had graduates involved in setting up the African and Caribbean Inequalities Review and coordinating and managing that process, working with partners and stakeholders and managing the recruitment process with us. So lots and lots of really practical things. And of course, through COVID, all of our graduates have had exposure and experience of working in health protection. So there's loads of things to do, and that's the joy of the city. If you are thinking about applying for one of these roles, a couple of tips, a couple of things from me that might be helpful. Please read the job description. Please read the personal specification. When you're doing an application, it's really important in your supporting statement to demonstrate how you meet those essential criteria in the job description and the personal specification. And a tip from me is turn that into a grid, all of those criteria, and in the box next to it, write the things that you do that demonstrates it. Demonstrates that you can do that and you have got that skill set. Then take that grid and turn it into a Word document. Turn it into something that flows. Really don't need to see War and Peace. So you really want to try and get your personal statement, supporting statement down to about 2 or 3 sides maximum. But try and structure it in the way that the personal spec is. So open up with, this is my qualification. This is how it's either a public health qualification or equivalent. Talk about your competency and some of the examples where you've done things. So I did this, the result was that, and the outcome was this. So really try and structure your personal statement to demonstrate why you're a good applicant for this job. If you get through the shortlisting and you're lucky enough to come to interview, we have a competency-based interview approach. And that again goes back to the personal spec. So we'll be looking for candidates that are able to answer questions and demonstrate how they meet those competencies. If you haven't got a perfect example, always think about saying, well, I may not have experienced this directly, but I have experienced this. And what I can kind of reflect on is how that experience transfers and could provide transferable learning to the question you're answering. Always think about the question, pause, reflect on it, and take a moment before you answer. Interviews about trying to help you demonstrate you're the best candidate for the job. So we are on your side, but it's up to you to do your best through it. If you do get the job and we offer it to you, these are full-time roles. We will talk to people about less than full-time if you request it. We've had candidates who've had disabilities before, for example, where we can make adjustments. We can help support that as well. We've got quite a strong learning and development program in the directorate as well. The public health division in Birmingham is about 80 or 90 people. So we're quite a big team and there's quite a lot of stuff going on. So it's a great place to come and learn and get your first kind of starting point in your public health career. Trying to think if there's anything else that I can say that will get you excited about these roles. I suppose finally what I'd say is that all of the graduates who've been with us have gone on to get other roles. And that's one of the really exciting things about this graduate intern program. We create it to give people that opportunity for the first step into public health. The opportunity is there to be grabbed and seized. And what I have really been excited about is the graduates that we've had over the last year have brought in new ideas, new experiences, because they're often fresh out of their courses. They're full of the latest research, the latest evidence. They've helped teach us things and help us reflect in different ways. But what's most rewarding is at the end of that year, many of them have gone on to other roles in public health. Some of them with Birmingham, some of them with other public health organisations or in the voluntary and community sector. And that's the success of this scheme. That's why we've developed it. So have a look, see if it's for you. And if it is for you, I'd be delighted to see your application. And I hope you do take a punt and come and try and join us in Birmingham.